Today I am here talking to you about fever. You may have been in the pharmacy recently or seen on the news that there are medication shortages, especially around some of the common medicines that we use in pediatrics, especially the liquid forms of things like antibiotics, ibuprofen, and acetaminophen, which is Tylenol. As far as acetaminophen and ibuprofen go, those are medicines that we frequently use for pain and for fever. So let's talk a little bit about fever in your kiddos. Fever is a temperature above 38 degrees Celsius, which is the same as 100.4 degrees Fahrenheit. So this means that your body is inflamed and fighting off some sort of an infection, usually a viral or bacterial infection. So it can actually be helpful. That fever, that high temperature can help kill off some of the invaders that are in the body, whether they're bacteria or viruses. So it's not always necessary to take medicine for a fever if your child's otherwise comfortable and doing okay. The things that we worry about are dehydration and temperature getting too high that can actually cause harm to the body, but really that doesn't happen until you get a temp of about 105 or 106. Most kids won't get that high if they are otherwise healthy. And so if you have a fever and your child's uncomfortable, Tylenol or ibuprofen is a good way to approach that. If you can't find those medicines in liquid form, a couple of tips. Number one, it's fine to use generics. Those are the same as the name brand. So if you can't find Tylenol, but you can find store brand acetaminophen, that's fine. Same thing with Motrin and Advil are the same ibuprofen medicine. Generic ibuprofen is fine. If you can't find the liquid and your child can't swallow a tablet, you may have to crush it up and put it in a little bit of liquid or a little bit of applesauce to get it down them. You can always call your doctor's office for details on how to do that, but sometimes we have to get creative if we can't find the liquid forms of these medicines. I also want to give you a few tips of when it's important for you to call your doctor or go in to see your doctor. If your child has a fever and you can't get it to come down at all with acetaminophen or ibuprofen and your child's very uncomfortable, we'd like to see them. If they have a fever without any other symptoms for more than 48 hours, we'd like to see them to rule out certain kinds of infections. And if you can't get them to drink enough to stay hydrated, that means they're having at least 3 wets in a 24-hour period, then we want to see you in the office as well. And again, you can always call if you have any questions about your child's fever.